about their latest acquisition, and that's a positive news flow coming in for the company as well. Indegene has acquired BioPharm to advance their AI-driven life science marketing. So here's the case for a chat that we plan to have with the management of Indegene. What's the strategic rationale behind acquiring BioPharm? How will this acquisition and AdTech tools, how will they integrate with Indegene's existing platforms? How will this strengthen their presence in the US, and any impact on financials? So let's get that conversation going. And thanks so much for your time this morning, Mr. Gupta. First up, let's start by talking about the strategic rationale behind acquiring BioPharm. Help us understand how this is going to integrate within your existing systems, and what are some synergies we can expect to see here.
Sure. First of all, thank you so much for inviting me to this show. Now, through this acquisition of BioPharm, what we are doing is doubling down on a bet and direction we took approximately 15 years back. The bet was the following, that digital will fundamentally transform how pharma does sales and marketing. Pharma sales and marketing, which used to be highly decentralized, med reps on the ground, pounding the streets to physicians, will shift towards a much more digital and also some bit of centralized activities on the sales and marketing side. That played out well, and that is what resulted in us converted from approximately $10 million business in 2010 to 335 last March, 2025 March. What we are doing is doubling down on that bet, and the reason we are doing that is that we see the next level of evolution of this whole sales and marketing model, this time driven by AI. Right? AI, digital is going to continue to increase as a percentage of the overall spend. Within digital, there is more and more automation using AI. That's activity which was happening a lot. And to do that well, more centralization will have to be done. BioPharm fits in very well with this overall strategy of ours, and that's why we made this acquisition.
Mr. Gupta, hi morning. This is Shrishti also joining in. But how will BioPharm's AI and ad tools integrate with Indegene platforms? Are there any synergy benefits you wish to highlight?
Absolutely. So here is how pharma sales and marketing works. If I just explain it, there is a strategy piece in strategy and planning. That's one part. The second part is content and creative. And in this industry, content is super important. Physicians make their calls on prescribing a drug based on the content they see. Third is what is called campaign execution. We are very strong in content. We strengthened our creative piece by doing an acquisition of a company called Cult based out of New York in 2022. Now, what BioPharm does is strengthens our campaign execution piece. We were doing campaign execution, but more for centralized marketing teams of life science companies. BioPharm is very, very strong in the brand side of the whole pharma stuff. And that is a very important area as we scale our presence. So that's one area. We being strong on the centralized side, whereas BioPharm bringing the brand expertise. The other thing is BioPharm has a very strong data set for physician propensity, digital propensity. We had a product called Envisage, which had profiled 1.8 million physicians for their digital propensity. BioPharm has a product called Tandem, which has 3 million physicians profiled for their digital propensity. It has many more channels which physicians use. On the other hand, what it also does is it extends our data sets in areas like oncology, rare diseases, and ophthalmology. So the increase in data sets, increase in channels, and addition of the brand sides is what BioPharm brings to the table for us.
Okay, so thanks for that, Mr. Gupta. Also, before we let you go, help us understand what's the integration timeline of this acquisition into the company, and some key milestones that you are targeting to hit on the back of this acquisition.
So the integration timeline is going to be approximately 15 months or so, call it 15 to 18 months at the max. That's what we are looking at. The immediate milestones for us is that we have a few pretty significant deals in the pipeline. As pharma companies are thinking about their mature product portfolios, they're thinking of shifting marketing dollars from feet on the ground, reps on the ground, to a much more digital outreach, right? And use that money which they save to finally invest in the new launches. We believe that this deal essentially increases our chances of winning with some of these clients. So I would say we going together and winning in the market with these deals is going to be the first immediate milestone, which we are super excited about over the next few months and quarters.
All right, very good to know that. Mr. Gupta, with this we'll let you go, but thank you so much for taking the time out and speaking with us.
Thank you so much. Pleasure being here. Thanks.
Likewise. But with this, viewers, it's time now to slip into a very short break. Don't go anywhere. Lots more to talk about on the other side.